everyone, I am Dr. Bhumika Rai, Consultant Obstetrician and Gynecologist at Apollo Hospitals, Navi Mumbai. Welcome to Ask the Doctor by myHealthmeter. Today I am here to answer some important questions regarding women's healthcare, pregnancy and gynecological issues. When should I visit a gynecologist after confirming pregnancy? The answer would be to meet your gynecologist immediately as soon as the UPT comes positive. Reasons being to know where the pregnancy is located, how many weeks is it, whether it is one baby or twins. For all of these reasons, you need to visit your gynecologist immediately. On to the next question now. What is ectopic pregnancy? Pregnancy that is outside the uterus, most commonly seen in the tubes, ovaries and cervix. Complaints would be spotting or missed period or very slow period during the cycle with extreme pain abdomen. How would you confirm? A weekly UPT positive, beta HCGs would be lower. How do we treat them? If it's detected in the very early stages, then you could treat it medically, and if it's later on, it will need surgical intervention. Is bleeding during pregnancy common? My answer would be no, because bleeding can be of various stages. It could be indication of abortions. If at all it is just spotting and before 5 weeks of pregnancy, of course we can reassure you saying it could be implantation bleeding, however not necessary. So you need to visit your gynecologist immediately if you see any amount of bleeding, minimal or more. How serious is PCOD? PCOD can be mild, moderate or severe. How would we grade them? Depending on your hormonal tests, sonographical findings, we would decide whether they are mild, moderate, severe. Why is it necessary to know the severity? So that we can treat them accordingly. If it is mild, the treatment would be lasting for 3 to 6 months. If it's moderate, it would be from 6 to 9 months. And if it's severe, it would even require 1 to 1.5 years. What is endometriosis? Endometriosis means the lining of the uterus, which is inside, is also found outside the uterus. So whenever a woman is during her periods would experience extreme pain because they are bleeding from all the sides where the endometrial deposits are there. The deposits could be anywhere in the rectum. It's also seen in the maximum stages like rectum and urinary bladder, where the woman would complain pain all the time, even not during periods. They would have chronic pelvic pain, pain during sexual act, pain during periods, pain during passing urine or toilet. What are fibroids? Fibroids are benign tumors on the uterus. They are not cancerous. However, they need to be addressed. They are most of the time, patient comes to us when it's bigger in size because the complaints would be later on. Sometimes picked up in early stages during a routine ultrasound. If the size of the fibroid is small, need not worry. But if it is moderate and if it's bigger in size, you need to go to your gynecologist immediately. Also, if you have complaints of bleeding, pain during periods, you need to go to your gynecologist. What are ovarian cysts and how do they differ from PCOD? In ovarian cysts, the cyst will be either unilateral or bilateral. They are classified as simple or complex. They can be even endometriotic cysts. In PCOD, it means peripherally placed follicles in the ovaries, not necessarily multiple large cysts. So this is the difference between the two. Thank you for joining me today on Ask the Doctor by myHealthmeter. Until next time, this is Dr. Bhumika Rai wishing you good health.